I'm Lori Murray, President of the Committee for Economic Development of the Conference Board. No one could have predicted this confluence of events just a few months ago, beginning with the COVID-19 global pandemic, the ensuing economic crisis, then the death of George Floyd at the hands of police, and now the seismic street protests driving a sea change in public consciousness. CEOs across the corporate landscape have added their voices to the discussion and are determined to use their influence to make lasting change. For over 100 years, the Conference Board has helped the world's leading companies and society at large navigate crises and develop reasoned solutions for the country. Founded amid labor unrest in 1916, the Conference Board led the adoption of workplace safety reforms, compulsory health insurance, and the 8-hour workday. We were at the forefront of conversations regarding the opening of the workplace to women, people of color, and people with disabilities. Our policy center, the Committee for Economic Development, which I lead, helped shape the Marshall Plan that rebuilt Europe after World War II, as well as the Jobs Act of 1946, which set forth workplace reforms. That tradition continues today with our efforts to shape public policy that impacts our workplaces, communities, and government. Given recent events, the Conference Board is launching this series of CEO forums to foster action called Building a More Civil and Just Society. The CEO Forum series features CEOs from across American industry who will focus on actionable insights to address our societal challenges. Today, we are talking to Michael Neidorff, who is Centene Corporation's Chairman, President, and Chief Executive Officer. He is a recognized leader in the industry who is committed to building a multinational healthcare enterprise while upholding Centene's local approach to healthcare. He demonstrates a history of successfully implementing programs and services under Medicaid, Medicare, and commercial managed care. Under his leadership, Centene has grown from a $40 million corporation to a publicly traded Fortune 100 diversified healthcare enterprise. Michael dedicates significant times to civic organizations. He is a board member of the National Urban League and has served as its chairman from 2014 to 2019. In 2015, he was inducted into the Hall of Fame for Junior Achievement of Greater St. Louis. He served as a member of the board of directors of the Greater St. Louis Boy Scouts of America since 1990. Michael is also a member of the board of trustees for Trinity University in San Antonio, Texas, his alma mater, and previously served as chairman of the board. Thank you so much for joining us today, Michael. And I'd like to start by approaching the what's happening in our society a little bit more broadly and get your views. Given the events that have followed the killing of George Floyd, how would you characterize the social state of our nation? And is this different? We've dealt with the issues of racism and inequity over time. We've seen civil unrest that decries them. But is this a different time for America? Are we at a point where you think it might be possible to have lasting positive change?
I would hope so. I think we have to change. More of the same is not acceptable. But I want to tell a little story, if I may, that I think will give you an indication of what I think has to happen. I assumed responsibility as chair of the Urban League 1 week after Ferguson and those issues. And at my executive committee dinner, they pointed out to me what happened at Ferguson could happen in 150 cities in this country. So I made up our mind, we had to show them what to do about it, not complain about it. And I heard that small businesses were going out of business and were not going to reopen because of the looting and things that happened there. I also learned that they arrested 18 people one night, and they were all from out of town. So a lot of those things were not instigated by the people who were trying to get positive change, but were using it for other purposes. So what I did, I got together with my board. I'm giving you the Cliff Notes version, and said, this was the Friday before Labor Day, I called them and said, I'm going to open a service center in Ferguson. Because if the small businesses did not reopen, that's the fabric of any community, that town was going to die. And the Tuesday morning at 6 a.m. after the Labor Day weekend, we announced we're going to open a service center in Ferguson and spend $35 million to do it. All the small businesses said, if they're coming, we're opening. And in fact, when we had our grand opening, a couple of the companies, the food service companies and that, catered our opening ceremonies with the food. So, and one more anecdote. I reserve the right to stop by any office we have anywhere in the world, and this card opens it up. So I can show up unannounced and people know I'll do that. I went in one day to Ferguson at the training center across the street, and we're talking, and that just shows you how people's attitude when they're given the opportunity. I said to them, we're going to have a lot of security across the street. And they said, we understand. They said, but they called me Mr. Mike. They said, Mr. Mike, no bad apples are getting in there. If we know somebody's a troublemaker, we're going to tell you. Which says give people the responsibility, the accountability, the opportunity. They take that responsibility seriously. So I think what we're seeing and what happened with George Floyd, reprehensible. I mean, it just points to what's out there and can happen. That's underlying it. And what we do about it through responsible action will make all the difference.
And looking specifically at healthcare, COVID-19 has shown a spotlight on the inequities in our society, and particularly with the disproportionate, devastating impact of the pandemic on Americans of color. Can you tell us what you've been doing and seeing both within your network as well as within your workforce of frontline workers in this crisis?
Well, what we've been doing is, one, you do some analysis, and what's occurring is real. And our population, we deal with the fragile population, people that are really at risk. So we've had programs to do that. But they also live in a more concentrated environment. So it's much harder for them to socially separate. So we have to understand those things and do everything we can to get the PPE to them, the personal protection equipment. I think we spent $3.5 million in the first couple of weeks to make sure people had masks and the hand sanitizers and things to help them. So I think what you have to do is recognize the environment in which they are and give them what they need to allow them to do it for themselves. And we have done that continuously. All during this pandemic, we've had two issues. Keep our employees safe. We moved 66,000 people home in 3 days. Now, 52% of our population, employment population, are people of color. And also, having heard your opening comments, you'll be happy to know that 75% of them are female. Okay, and so when you recognize all those things and you do the responsible things, give them the assets to do something about it. It makes all the difference.
So, what can you take forward from the lessons you've learned in this crisis, in terms of what major changes need to take place once we get through this pandemic, in terms of both in terms of your workforce and the at-risk populations?
Well, I think the vulnerable populations we work with day in, day out, and we help them understand and ensure they have access. We waive co-payments, you do things, so they can get the test, help them get the test, do things that help them make a difference. So what we want to do is enable people and get them access. And we work with the federally qualified health centers. That's the safety net of all this, and make sure they have what they need. So we learn from that. What we're doing there is invaluable, and we have to do that. Two, the education of employees of what to do. Unfortunately, I don't believe this is going to be the last pandemic we're going to see in our lifetime. I think that these things have a way of, repeating themselves. So we're going to try and help people. And what I'm working hard for, and this sounds more political than I wanted to, but I think we need to see the kind of leadership that shuts the place down. And we've had some of that here in St. Louis, which has made a difference, and says, we're not going to reopen too fast. We saw it in Illinois and some other places. So I think what I hope public health authorities have come to learn in this kind of thing, you shut it down fast. You ensure that you're dealing with the issues and the support people need in that environment, and you don't open it too soon.
And then what needs to happen in terms of healthcare and making quality healthcare accessible to all as we go forward? What are some of the changes that need to be made?
I think as I look at it, right now, anybody under 100% of the federal poverty level, and now they've changed it up, 138% of the states adopted, have Medicaid, and we're the largest Medicaid provider there is. And I really believe that our individuals are getting the highest quality of care, and we can point to that all day long. But I'm not here to give this commercial for Centene. I'm here to talk about public policy. I think we have to think about policy, not politics, and get back to that clearly. And we're pushing hard on that. You know, we're recommending, after the election, we're going to push it, that people 100% or less at the federal poverty level have Medicaid. Above 100%, instead of 100 to 130, go 100% above, put them in marketplace to 400% the federal poverty level. That'll cost the country something like $6 billion. And by doing that, I tell people we're teaching people how to fish rather than give them a fish. They start to learn how to use insurance. And as they move up the socioeconomic ladder, the subsidies tail off. So there's things we can do to ensure they have access. What we have learned more than anything else from marketplaces, people love to have a card that they can walk into a hospital or doctor and say, yes, I have insurance. Versus saying I'm here for, so let's get them that access. Single payer is not the answer. I've studied it, I've lived under some of it, and I have to confirm this. I haven't looked at it recently. Years ago, I looked at it and I was in Canada. And they had more MRIs in Philadelphia than the country of Canada. Because the only way single payers can can control costs is withhold service. And if you look at England and other countries, everybody takes the government program, but if they can afford a private program as well, they take that too. We have a big business in England, so that's how the UK, so we know it. I'm being verbose, and I apologize for that, but there's a lot we can do, but it just keep it simple.
Yeah. And, you know, you've been engaged in your community, addressing these issues as well as within your organization. And as a CED trustee, you're also engaged with us on the public policy front. What's the advice you would give to business leaders in terms of your engagement, how you see your role within your company, on your issues, as well as dealing with these issues more broadly in terms of your role as a CEO in your community?
I think and I talk a lot about this when I was chair of the Urban League, we have to take an approach of responsible activism. And that says that we help to call things to people's attention. We help underserved people understand that they, in fact, do have opportunities and ways to meet their needs, educate them. And that has to be our role in industry. And find the responsible organizations and support them. Obviously, I'm a big fan of the Urban League, what they've done. And St. Louis has the strongest chapter of all their affiliates. And they played a role in Ferguson and still do. So I think we have to find the right organizations that are making a difference, helping underserved populations, all populations, not just of color, and help them get access to health care, to employment. And we have to encourage more job training too, because the biggest thing, Ferguson, property values, everything started to turn around and go up. Why? People had jobs. The 300 people we hired up there were from that area. That makes all the difference in the world. So I'm encouraging others to help working on job training.
Michael, just in terms of the defining moments that set the course in terms of your values as a major business leader, not only in the US, but globally, what were some of the defining moments in your life that helped set your course in terms of the values that you brought to your position?
You know, somebody else asked me that. I'll never forget, I was in junior high school, and I was chatting up this gal, and her boyfriend didn't like her and turned around. He was much bigger than I was, and he hit me. Okay. And another friend of mine who was black and was a Golden Gloves champion went up to this other guy and said, "You touch Neidorff again, you're going to answer to me." That just eliminated all these issues in my mind. We were friends, and that's what it was all about. My father was a very high-quality physician, won the Von K. Gold Medal for his work in immunology the year before so. But if somebody came in and couldn't afford it, they got cared. But I also saw when they could pay him, come back in and pay. So there are things of that nature that say if you support people in the right way and help them achieve and help them maintain their dignity, a lot can be done.
Michael, thank you. Thank you so much for joining us in this conversation. Thank you so much for your leadership and what you're doing both within your company and for American society at large. Really a privilege to talk to you. And thank you to all of your frontline workers who have been dealing with this crisis and help us navigate it.
Thank you for giving me the opportunity to participate in the organization. For getting it, we want to ensure we give some back because we're getting a lot out of it. So thank you.